few days now, Nigerians have been on edge following the inevitable, as it were, arrival of coronavirus in Nigeria. Restricted thus far to Lagos, although we understand that there have been, cases of isolation in Benue State, in Plateau State, and also in the Federal Capital Territory. However, the authorities have been on their feet, trying to take control of the situation. Many Nigerians are simply holding their breath, hoping and praying that the situation does not get out of control. But what happens in terms of the necessary interventions that must be made to keep everyone on the safe side? For a conversation on all of this, we will shortly be joining our Rice Abuja studio, where we have Professor Abdusalami Nasidi, a virologist and pioneer chief executive officer of the Nigeria Center for Disease Control. Professor Nasidi is a physician with more than 32 years of experience in clinical medicine, public health, virology, and the development of vaccines and biological products. But to set the stage for this conversation, our Rice News correspondent, Olushola John Jacobs, has put together a report on the fight against coronavirus in Nigeria. Let's take a look at that.
It's no news that the new coronavirus case has come upon the world, and with its presence in almost all the continents, as well as over 2,993 deaths out of over 87,000 cases so far recorded, it may as well be around for a few more days. The coronavirus, which emanated from Wuhan in China, has caught the attention of world leaders, and not one of them would go as much as handling it with kid gloves.
Some measures, we've been in very close contact with China, including myself with President Xi. He very much wanted this to happen. He wanted this to get out and finished and be done. He's been working very, very hard, I can tell you that. And they're making a lot of progress in China. You probably saw Starbucks are now opened again. You probably saw that, as I mentioned, Tim just came out and he said Apple is back to normal in terms of production and their facilities in China. They've made a lot of progress.
I think it was we were following the best medical advice, and we regret we very much regret the loss of life of the individual concerned. But we think that the best thing to do is not to move people around too much in the current situation, not to repatriate, unless you can be absolutely sure that there isn't going to be a spread and a contagion to this country. So that's the principle that we're adopting. We're meeting continuously to deal with this. I just want the public really to understand that the NHS is a fantastic system. I saw what preparations are being made. I was in Kettering General Hospital actually looking at the coronavirus pod that they have there, and looking at the kind of preparations the NHS is already getting underway.
With the latest case of the virus in Nigeria, all eyes have again shifted to the most populous black nation. And though the Nigerian authorities are apprehensive, yet they bask in the success recorded in the case of Ebola, for which the international community gave them kudos.
The case was confirmed on the 27th of February 2020 and is the first to be reported in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. He was confirmed by the virology laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos.
People are out there now trying to track every suspected interaction that this patient might have had contact with, and we're ready. Our facility has been fortified to continue, if need be, of any form of tests and containment, if need be.
Recall that the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, had earlier expressed confidence in Nigeria's ability to contain the virus, going by the manner the country swung into action in the case of measles, Ebola, and most recently, Lassa.
Continued increase in the number of cases and the number of affected countries over the last few days are clearly of concern. Our epidemiologists have been monitoring these developments continuously, and we have now increased our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global level.
The first case of the virus was an Italian man who traveled from Milan on February 25th to Lagos State and has since been quarantined by the Lagos State government. And on Saturday, he was moved to a new facility in the state.
Lagos experienced the Ebola outbreak in 2014. Ever since then, we've been building capacity because we don't want to have another such-like situation. We've been building a biosecurity unit at the Infectious Disease Hospital. That includes advanced diagnostic capacity in what we call a BSL-3 laboratory. It's the only one. We've been building our isolation capacity. Isolation wards are different from other wards. They have to have a special airflow dynamic. So we have 2 of them. As we examined them, we thought, well, okay, they were okay. We could have admitted patients, but we decided to go through a very quick renovation just to make sure that all the plumbing and air conditioning is working. We did that last week, and then we moved brand new furniture into the place. The patient came, and we just had to tweak 1 or 2 electrical installations, and then we just moved him in yesterday. So we have now ramped up our capacity to about 100 beds.
And while the index case of the virus is recuperating in the new facility in Lagos State, Governor Babajide Sanwo-Olu has paid him a solidarity visit, even as he hopes to upgrade the standard of the facility as time progresses. At the moment, a total of 39 people have been quarantined across Nigeria, but with intensified efforts from the nation's authorities and its governors, who had vowed to swing into action, it is hoped that, like other past incidents, the COVID-19 case also would go away sooner than it came.
Well, that was that. Let's cross live now to the Infectious Diseases Hospital here in Lagos, where the Italian diagnosed with COVID-19 is being treated. Our right senior correspondent, Tokunbo Oyetunji, joins us live now from there. Tokunbo, what's the situation on ground? Hello, Tokunbo. Good morning.
Good morning, Ruben. Good morning. You can hear me in the studio. Greetings to you from the mainland hospital here in Yaba, where the isolation center and the only recorded case, that's the Italian man who came into the country and down with the coronavirus, is being kept. Of course, we're told by officials of the state led by Governor Babajide Sanwo-Olu, who was here yesterday on a stakeholder consultation, that the man is improving and his condition is stable, and they are doing everything possible to actually contain the situation and ensure that the virus does not spread beyond what we currently have.
Yeah, but what is this? But what's the status of that, center? Because we've had reports that, there are some issues in terms of maintenance, in terms of facilities. Can you hear me?
For now, yeah, I can hear you. You're asking me what the situation is?
Status of that facility, the Infectious Diseases Hospital, because some people have expressed concern about it.
Well, yeah, you're right, Ruben. The report at the weekend was that the patient attempted to actually escape from the center because of the situation at the place. But the officials of the state, led by Governor Babajide Sanwo-Olu, have actually debunked that rumor. They admitted, actually, that the man has been moved away from where he was kept originally, from Friday when the case was recorded. And they wouldn't say what exactly was responsible for them moving him away from there, meaning that we could have some truth in the fact that the facility was not put in proper order before it was brought there. But what we have been told is that they keep improving on what we have on ground, and that what we now have is a much improved situation from what we had on Friday. Of course, it's a situation that is developing, and we are actually restrained from going beyond the point at this facility. But from what officials are telling us, the man is now in a better condition, and his condition is stable. So we take their word for it, Ruben.
Thank you very much, Tokunbo Yetunji. That has been Tokunbo Yetunji, Arise News senior correspondent, reporting live from the Infectious Diseases Hospital in Yaba. We will now join our guest, Professor Abdusalami Nasidi, in our Abuja studio. Professor Nasidi is a virologist and pioneer chief executive officer of the Nigeria Center for Disease Control. Professor Nasidi, good morning.
Good morning.
Good morning, Prof. Good morning. Good to have you on the morning show. Well, quickly.
Yeah, good morning.
I mean, this is a familiar subject for you. What's your assessment of what Nigeria has done so far in handling the index case that was reported on February 27, and steps that have been taken previously and now at the various ports in Nigeria?
Well, we must say that this time around, Nigeria has done, again, very well, at least in identifying the index case quickly and being able to confirm the diagnosis without waiting for samples being sent abroad, and we wait for 1 or 2 weeks by the time the virus must have escaped into the community. Secondly, we are even ahead to say that we have a place to take the patient to, that is the Yaba Infectious Disease Hospital, which we mobilized during the Ebola outbreak and used effectively to handle the various Ebola cases we saw in the country. So at least that is another plus, that Lagos State was able to sustain that center and prepare it for this type of emergency. And then thirdly, the Federal Minister of Health is involved right from the word go. So you can see that there's advocacy at the highest level, and this was not something that we saw at the early days of other outbreaks. But some of the things that we believe we should have done was to prepare the nation, not just the health sector, the nation for the possible outbreak, particularly seeing how this tiny virus is devastating very powerful countries like China, Japan, Italy, and now even the US is under the hammer of this virus. So we should start looking beyond just the health sector.
Thank you, Professor. Now, it was said that it was a matter of time before the virus actually infected anybody in Nigeria because we did not impose travel restrictions. This is how this Italian gentleman, who is our patient zero, got into the country. Now, do you think if we continue our reluctance, as it were, to impose travel restrictions, is that just an open invitation for the virus to continue to spread?
Absolutely. And I think at that phase, that is before the first case was reported, our alertness and our readiness at the port health level is just the tip of the iceberg. That's just the beginning. So we didn't have mechanisms on ground to say, okay, if somebody lands and is already from this country, not necessarily positive for the virus yet, to have places we can hold them, at least for the first 14 or 21 days. countries like ours that are not capable to provide, multiple bed, capacity for severe infections that could be caused by this virus, we should, emphasize on getting them very early and then placing them on whatever palliative treatment we could. So I thought we should have immediately started, by getting the passengers coming from countries at that time more affected to start either keeping them in not isolation, but at least some poorer countries in Africa actually, started using what we recommended when we were in Liberia, Sierra Leone and Guinea, to even get hospitals, designated hospitals, and also we can rent hotel or, estates where there are nobody to start putting these people together. On travel restriction, we should have at least made announcements and protected Nigerians to at least beware, except if necessary, not to travel to these countries, And finally, we thought that we should have evacuated or done something to the Nigerians that were in China. So these are the lapses that we didn't actually pursue that could have helped us much better.
Thank you, Professor. And it's interesting that you said that, the last point that you made about us doing more to have brought Nigerians back from China. When we spoke to the Director General of the NCDC on the show, he expressed that it's basic public health policy not to bring people back and have the risk of infecting the country. And that was his point of view. So I want to take you up on that and whether you think the Director General of the NCDC is right in this particular circumstance, or you stick to what you said about us actually bringing Nigerians back, and that should have been a point. And I also wanted to ask you about the biosafety level 3 lab that we have and its capacity. Is that enough to fight a virus like coronavirus? Some people have questioned whether maybe we need a biosafety level 4 lab, but I understand that we're also one of few countries in Africa to even have a biosafety level 3.
Well, you are right, and the DG NCDC is right, only at the latest stages. This virus was initially found in Wuhan, in the Hubei province of China. And at the early stages when it was spreading slowly, wise countries started moving their indigenous away from there. Not when the virus became so widely spread that it doesn't have any meaning anymore to bring them back. So, but countries that moved early and moved their people out, and I think they provided that type of hope to their indigenous that their governments are ready for them anywhere they are. So it is because, we didn't act quick. It became so late, the whole city became engulfed with the virus. So at that stage, even if you bring them back, it doesn't have a big meaning anymore. So the DG NCDC could be right, but not at the beginning of the epidemic, if we have done it earlier. Then a second question on the Biosafety Laboratory 3 that we have, I think that's a great gain we had after the Ebola outbreak. Now we have about 3 or 4 such laboratories in Nigeria, and they are not just there, but very active. So you don't need many of those biosafety laboratories to fight a disease like this, but you should have one that you can use to quickly diagnose and identify the virus, and then by that doing, you will reduce your response time, and then your response will be more effective. We don't need biosafety laboratory 4 now. It's very difficult to handle. Countries like France and Italy and also that attempted to have them or are having them, I find it very difficult to even handle them. So at our own level here, Biosafety Laboratory 3 is adequate for now for us to be able to handle this type of viruses.
Well, Prof, the president, speaking through Garuba Shehu, his spokesperson, has advised us not to panic. But shouldn't we panic, considering the information we keep getting about the threat of coronavirus in Italy, in South Korea, even in China itself, even in the United States, they've recorded their first death from COVID-19. Don't we have every reason to panic? And what do you think government should do to make the situation better, to reassure Nigerians, apart from travel restrictions suggested by Tundun earlier on?
Well, thank you very much. I think now that the virus is here and we don't even know really if this is the first case, we are just saying this is the first case we have identified. Maybe some had sneaked in and the viruses are lurking somewhere, again in other parts of the country. So we should regard the whole country as possibly, having the virus, not just Lagos. We shouldn't just be saying Lagos, Lagos, Lagos. So our preparedness should be for the entire nation, and if possible, we should involve the region to do something, to start, coordinated fight against this scourge, which, if you're not careful, could, ruin our, economic gains. On the issue of the message from the presidency, I think the best way to let Nigerians to be calm and not panic is for the president himself to come and address the nation, not through Garba Shehu. He should have, calmed the nation by saying, "Oh, we know what is happening and we're preparing," and he should give the assurance, to the citizens. And that's number one. Number two, yes, Nigerians shouldn't panic, but Nigerians should worry, because if this disease can, devastate strong countries like China and Japan and others, then we should double or triple our efforts at trying to curb the spread of this virus, because of so many other factors that we have, like underlying diseases, epidemic outbreaks already ongoing. Malaria is there. We are number 2 or 3 in the world on TB. We have Lassa still devastating some states. So this will, make our own problems to be a little bit more serious. So we need to do more than even some of these countries to be ahead of this virus.
We certainly do, sir. And you just referred to something I was going to ask you. Now that a lot more fatalities have been recorded, there seems to be a trend that those who succumb to coronavirus or COVID-19, the disease, have some sort of immunity compromise, either as a result of their age or pre-existing medical condition. These are the vague references that we've been hearing in the media. But can you give us some examples of what constitutes a pre-existing medical condition that could make somebody more vulnerable to COVID-19?
Well, it's already been proven by these countries that are suffering from the outbreak, that people with comorbidities, that is, other diseases, before the Wuhan virus came in, are much more vulnerable and have the chance of dying than those who are young and don't have any comorbidity. So, for instance, it's unfortunate that even though our HIV incidence has gone up, has gone down substantially, but the volume of Nigerians still having HIV and the immune-compromised disease are still very high. And you can imagine what this will do if this virus affects them. The virus is behaving as if it's an opportunistic virus that wants to get a weak body to kill. So we have large volume of people with HIV/AIDS. We have large volume of people with TB, and malaria also reduces person's immunity. So that means we might end up, if this disease spreads, I hope it doesn't, have more case fatality rate, or more people dying from the virus. Maybe out of 100, ours will not be 2.2%, it might be a bit higher. Then lastly, I must say that there are other agencies of the Federal Ministry of Health that are doing very well, like the MPCDA, the NACA, and of course the NCDC. Luckily, we have very strong young men heading these organizations, and they've changed our ability. They've changed the strength, increased the strength of these centers, and we are doing things that we couldn't do before. So that calms our nerves, and so definitely Nigerians should not panic, but they should worry. But the government should worry, and if possible, a little bit panic, because this can lead to the destruction of, actually affecting our economy seriously. So we need to wake up.
Absolutely, Professor. And now I want to take you on to speak about basic public health policies that we can learn from the poor handling of coronavirus in Italy. This is because Italy, of course, is the country where patient zero came into Nigeria, well, our patient zero came in from, and also the country that spread the virus to every other country in Europe. One of the main reasons for this, of course, is the fact that the EU has no public or no harmonized public health policy. Does that sort of pose a threat here in ECOWAS? Do we have a harmonized public health policy that can ensure that other countries in ECOWAS are protected now that there's an outbreak in Nigeria?
That's why I said it's very important to have a national and regional coordinated response. Luckily, we must also praise the ECOWAS organization because they are the first in the region, in the Africa and many other countries to actually have and launch this regional center for disease control and start addressing public health policies on the regional level, not just national level. That will affect movements of sick people, movements of disease, and so on and so forth. So as soon as we established the Nigerian Center for Disease Control, the heads of states of all the ECOWAS countries came together and said, let's learn from the experience of Nigeria and quickly establish a regional CDC. And as soon as we established that regional CDC here in Abuja, many other regions of the continent started learning from us. And even the African Union had to learn from what we have done, and we went to AU to assist them to establish African Union Center for Disease Control. So we are now talking of not just a regional or sub-regional policy, but the way things are, we share a lot of, we share many common things with among all the countries of Africa, particularly the ones sub-Saharan Africa. So time has come for us to start evolving those type of policies. So the African Union, we should have a continental policy, then sub-regional policy. I think this is evolving, this is ongoing. Dr. Chikwe of the NCDC is handling this very effectively now, working with the ECOWAS. We believe that things would have to change because the good example is if you don't have strong public health policies and you have people deliberately spreading the virus, you will not be able to do anything. But we are now seeing today that Korea is even going to prosecute some people that they believe facilitated the spread of the virus. So if this type of things are happening, and the fact that the virus could escape to other weaker countries, if we don't take action, then you will not be able to effectively fight it without a living, serious and strong public health policy.
Well, Professor Nasidi, the virus is in over 30 countries now. Over 2,000 persons have died worldwide. But the WHO is still saying that it's not yet a global pandemic, that it's an epidemic. Do you think that the WHO is playing politics with COVID-19 and just restraining itself from raising an alarm, perhaps? And why is it so difficult for scientists to come up with the vaccine? The latest we had was that Israel has come up with something close to it, which has been tested in animals, but it will take another 3 months before that can be confirmed. Is there also a problem at the science end of resolving this crisis?
Well, thank you very much. It's not possible to say WHO is playing politics. WHO is there for all of us to protect us, guide us, and assist us in preparing for any health eventuality, health emergency, and for also making sure that we are safe, we are healthy. So there are criteria that WHO have to use before they can declare a pandemic situation. During the H5N1 outbreak that became a pandemic, we had to be very cautious. I happened to be the chairman of the technical working group at that time in Geneva, and I was traveling around the country. So you need to meet those criteria before you can declare a pandemic. So even though the cases are being seen in some few cases, in sporadic case way, they need one or two more evidence to now declare it a pandemic. But nevertheless, the last step to declaring it a pandemic is already pronounced by the WHO by stating that the world is now on a high risk level, very high risk level for the pandemic. So this means all countries have now very little windows of opportunity where we should start tripling or quadrupling our efforts to really get ready for the worst. So some of the things that we need to do in this regards is, to quickly make our fight multi-sectoral, like we did with the Ebola, and involve not just the government, public sector, but this is the time we should drag in quickly the private sector, to get us ready for the fight. Now on vaccines that you mentioned and other therapies, you must have heard that the WHO mentioned that there are more than 20 candidate vaccines being experimented with, and some of them, almost all of them, are biotechnology based, and that means we could get more accelerated approval by the WHO if they are found. Then, of course, there are other drugs that are also being tested, and we believe, maybe in the next 3 to 6 months, we shall have candidate vaccines that, if allowed, the WHO will definitely give accelerated approval, for us to start fighting the disease.
Fingers crossed. Thank you, sir. And now, regarding the experience that other countries have had, in the UK, people are being actively discouraged from going to their GPs or to accidents and emergencies if they feel they have symptoms for COVID-19. What is the proper protocol in Nigeria? Because as you said at the beginning of this conversation, we have testing facilities, but should people go to hospitals, or should they call somebody and have themselves tested at home so as not to potentially spread the virus? Because the last thing we need is another medical martyr like Dr. Adadeva, who we'll never forget. But we don't want another fatality of that nature.
Yeah, well, we can't compare ourselves with the US and other countries because their health emergency network is so effective. If you make a call, a health emergency call, within few minutes, they will land in your place with the ambulance. But here it's not the same story. If you are trying to say you will make a call and wait for the medical team to come in, especially resource-limited areas, you'll be surprised that number of people infected will be much higher before the medical attention comes. So we are going to encourage that we go back to what we did during the Ebola time, to be doing the self-check. All those who were suspecting must have come into contact with the person with the disease or travel to affected countries. We should start thinking of how to either keep them in quarantine in these hotels or other places that we told you, or we should actually encourage them to do self-check. We give them thermometers, let them check their temperatures morning and evening, and then we also get frequent visits. Not wait when you are called, but in a situation where they start developing symptoms or this and that, nobody should waste time. They should immediately look for the nearest health facility. And all healthcare workers too must be ready and protected because we are just talking about using masks, but the healthcare workers must be protected. They must use proper apparels, must be taught how to handle such emergencies. And that is another work by the Ministry of Health, that they should now intensify mobilizing all healthcare workers and thinking of how to protect them. If not, you can imagine what will happen in the health sector.
Absolutely, Professor. And as we round up the conversation very quickly as well, our immigration officers that are on the front line, should they also be protected with personal protective equipment?
Yes, the immigration officers that on the border, particularly those that will handle the passport and those that will welcome the citizen, must all start using their masks, and they must imbibe the culture of washing hands, and if possible, making sure that they don't come back home without doing the hygiene that procedures that we have recommended. So there should be special preparation and training of these workers, and this sort of happen in all other countries. Now, as I said, it's not issue of just health sector.
Professor
The Minister of
Nasidi,
Internal
thank you very
Interior.
much. Thank you very much, Professor Nasidi, for this very enlightening session with you. Thank you very much indeed.